Duggar Vuolo and her husband Jinger Vuolo recently found themselves at the center of criticism from fans after sharing details of their children's health scares and their approach to treatment. The spotlight intensified following two distinct incidents: the hospitalization of their daughter and a public discussion about their parenting choices, both touching on health and risk. Earlier this month, the couple revealed that their 7-year-old daughter, Felicity, suffered excruciating ear pain after attending a wedding at their home. According to their account, the child became distressed and unable to lie down because of the pain, prompting immediate treatment with children's ibuprofen. When that failed to relieve her, the parents went to the emergency room where doctors identified a popped eardrum and recommended antibiotics. Jinger said she hesitated, citing concerns over how antibiotics might impact gut health, and instead opted to wait and monitor the child, using alternative ear drops recommended by a friend. In a separate podcast episode, Jinger discussed her broader approach to her children's health, including letting them soak up some sun, without regular use of conventional sunscreen, and avoiding immediate antibiotic use for ear infections. She described herself as anti-medicine in certain contexts and favored crunchy or natural remedies for her children. Those decisions ignited a wave of fan backlash. Some viewers accused her of risking her children's health by delaying conventional medical treatment or skipping sunscreen. The criticisms focused on the idea that ear pain severe enough to warrant an ER visit and sun exposure without sunscreen could pose unnecessary danger, and that parents of public figures have a responsibility to err on the side of caution. In her defense, Jinger emphasized that her family's decisions stem from careful thought, not neglect. She pointed out that while doctors recommended antibiotics for Felicity, they chose to wait because the child showed signs of improvement, and so far, the outcome has been positive. She also explained that her sunscreen choices were made with mineral-based options in mind, and that outright avoidance of sun protection was not her stance, but a tailored approach based on intensity of exposure. Media analysts note this situation highlights a broader tension between alternative parenting philosophies and mainstream medical expectations. On one hand, parents today have access to broader health information and tend to question conventional treatments. On the other, the public, especially when a family is in the public eye, often expects a more cautious standard. The Vuolo's case falls neatly into this debate. They're going public about their choices, which invites public scrutiny. Another dimension: the children's prior medical incident. Jinger and Jinger previously disclosed that their younger daughter, Evangeline, age 4 at the time, was rushed to the emergency room during a family trip after experiencing a severe cough and difficulty breathing. While that episode surprised the parents, it did highlight that they have had serious health scares with their children, which may fuel some of the concern among fans now. For the Vuolos, what matters appears to be balancing parental autonomy with child safety. They've stressed their children are healthy and well, and that each situation is handled individually in consultation with medical professionals. Yet, the strong fan reaction reflects a feeling that public figures' parenting must meet higher scrutiny. As this story unfolds, what remains clear is that parenting decisions, even among well-known families, will continue to be scrutinized when they diverge from norms. Jinger Vuolo's case underscores how health-related choices by celebrity parents can become lightning rods in public discourse, especially when risks are perceived.